Regular dental checkups are sometimes low on the priority list, but did you know that taking care of your teeth can add years to your life and even prevent heart disease? Joining us to discuss this and more about dental care is Dr. Todd Russel from the Macedonia Dental Health Group. Welcome to the program.
Thank you, Karen. It's an honor and a pleasure to be here.
Well, we're glad to have you. Now, I've heard people say that, if I clean my teeth every day, if I floss, brush, I don't need to see a dentist twice a year. Is that true?
No, it's not. Unfortunately, no matter how good of a job you're doing at home, you're always going to be missing something. And you need the skill and the eyes and the hands of a good dentist and a good hygienist to find those things that you're missing. Over time, the plaque will build up in areas that your toothbrush, your floss, your dental picks, anything that you are using can't get to. Additionally, being seen twice a year by your dentist allows us an opportunity to not only look at your teeth and the health of your gums, but as I like to say, the mouth is a window on the rest of the body. And when we look in there, we're looking at your tissues. We can tell things like, are you a smoker, heavy drinker? Are you a diabetic? We see changes in your tongue that indicate different kinds of deficiencies. So just brushing and flossing every day, multiple times a day at home, really doesn't add up in the end.
Because there's some bacteria in there we can't get to and can cause some serious health problems.
Correct. There is a lot of research recently that has shown a connection between heart disease and oral dental bacteria. We're finding that the bacteria in the mouth can find its way into the bloodstream and then seed what we call plaques or buildups in the arteries around the heart.
So, there's so many toothbrushes out there. So if we're at home, okay, we decided we're going to you twice a year. You scared us into it.
Right.
But at home, we want to be kind of good.
Sure.
How can you figure out which toothbrush is right for you?
Sure. There are two types of toothbrushes that really work well for you. The manual toothbrush.
Okay, that would be. I picked this one up myself.
Perfect. And again, I'm going to say this: brand does not matter.
Okay.
The manufacturers may tell you differently, but really, brand does not matter.
Okay.
So you want a soft bristle toothbrush,
okay,
not a hard bristle toothbrush. Outside of that, a manual toothbrush or an electric toothbrush. Again, I brought a sample box of a brand, but again, brand does not matter. However, research has shown that the electric toothbrush is far superior as far as keeping your teeth and gums healthier than the manual toothbrush. So in my office, I encourage my patients to buy one of these, to use them regularly. Those patients that do use them, it's an amazing difference in how much healthier their teeth and gums are. These toothbrushes I give away to my patients at the cleaning appointment as a courtesy, like all dentists do, and I tell them, this is your travel toothbrush, this is your weekend one. You don't want to take this and lose this at the Holiday Inn when you're spending $100, $150, $200 on it. You lose Dr. Russell's toothbrush, no big deal. I'll give you another one the next time I see you.
That's right, we'll get it the next 6 months, or maybe we should be changing it in between there though, huh?
Right. So great product, okay product.
Now, what about dental floss? I am so confused by this because you go into the store, you see the wax, the unwaxed, the minted, the cinnamon. You see these little pick things, these little soft brushes.
Sure. What
are we supposed to do with our dental floss?
Right. Any type of mechanical removal of the plaque is going to be great. The floss, whether it's mint flavored wax, whether it's string, it again doesn't matter. The product is that it's just the mechanical removal. Pick what's comfortable for you. The different kinds, the waxed versus the unwaxed, some people have very tight contacts between their teeth.
Okay.
And that's where the waxed may help you slide through those contacts. There's a product out there called Glide. It's a Teflon tape. Again, it'll help certain people. So everybody's a little different.
Okay.
Experiment, buy one of each kind and try it. Ask your dentist for samples. We tend to get samples, of all the brands, and you can try them and see which one. Again, the key is that you're doing it. The other products, these small little wands and this Reach product, they're more for people who have difficult in dexterity. That is getting to the back far reaches of your mouth. Older people,
so it's
handicapped
not for every
people,
tooth.
Kids, teaching kids how to do it. That's a great product for a kid to go ahead and use.
But can you use this on more than one tooth? Because it's
Sure.
got a little string. Can you go from tooth to tooth?
Absolutely.
Or are you spreading
Absolutely.
bacteria when you're doing that?
No, you're not really spreading bacteria. Remember, all you're trying to do is it's mechanical removal. You're just trying to knock it free, and then when you brush and when you rinse, then you're removing it completely.
Gotcha. Well, let's go on to another question that a lot of people have, mouthwash. we got our, 99-cent brand at Mark's, and then maybe our $3 or $4 brand. Is there any difference?
There is to some degree a difference. One of the mouth rinses and one of my more recent favorites are the ones that contain fluoride. Okay. We're seeing a large number, especially of younger individuals, drinking a lot of the pop, the highly carbonated beverages, and not just the ones with sugar. It's even the sugar-free. Carbonation causes an etching of the teeth, which then bacteria live on, and that consequently creates more decay. Concentrated fluoride rinses will help to combat that. Of course, stopping drinking those kind of drinks will really help you, but this will help to build back or remineralize the teeth and protect them. The other mouth rinses, your Scopes, your Listerines, they all contain different things. What we try to get you to shy away from, and again, especially younger kids at home, are the ones that contain alcohol. I don't recommend those. Those dry out the tissues of your mouth, which can actually lead to more bad bacteria growth. And also it contains alcohol, which you really don't need. I do caution people, though, on which mouth rinses that they do buy. Again, buy the smaller version, try it. They do, like I always said to somebody else earlier today, it's like a new car. Every year they come out with something new. Be wary of that, too. I don't know all the chemicals that they're putting, and the other thing you don't know about is the cocktail of the chemicals. They added this one in with 3 or 4 other things. You don't know how it's going to react to you. It may be okay for me, but it may actually hurt you. You may wake up with a funny feeling on your tongue after you've rinsed with it. So try a little bit of each one. Avoid the alcohol ones. Try to use the ones that contain fluoride.
Well, you are an incredible wealth of knowledge. How can our viewers reach you if they want more information?
Sure. Our office phone number is area code 330-468-6670, or you can check us out on the web at drtoddrussel.com.
Thank you so much.
Thank you.
We'll be right back with more Mind, Body, and Spirit.